Hi, I'm Dr. Mike from the Springfield Wellness Center, and what we're going to be talking about today is desk sitting syndrome, what that means, what it entails, and then how do we correct that. So desk sitting syndrome is a combination of things, and it really boils down to is just basically bad posture. We have lots of individuals that come in the office that sit during the course of the day, have done it for 10, 15, 20, 25 years at a time, and it really comes down to chronic repetitive stress put onto your body that turns into symptoms and problems and issues going forward in the future. And so positioning wise, when we're looking at a seated posture, what we're looking at is a couple of things. And so Kayla is doing a very good job of showing poor posture at the moment. She's very rounded through her upper back. Her head is kind of displaced forward to her shoulders, arms resting on this, feet are not flat on the floor. The workstation as well kind of plays into this too, and so she's not set up perfectly kind of for what she should be. So if we were to correct this position that she's in, she needs to sit up a little bit taller through her upper back, roll her shoulders back into the sockets, keep her ear nice and lined up with her shoulder, so in this good neutral head positioning, and then eyes should be straight forward. So if we show kind of the computer screen she's working at, this is a pretty good height for her, maybe a little bit higher she could deal with in terms of the screen, height of the screen. We want to see her eyes at about the top third of the computer screen. In terms of arm positioning, we'll want her arms nice and relaxed at her side with her arms straight out in front of her. This is kind of our ideal typing position. So where the keyboard is at and the mouse is at is not ideal at this point in time, but if we were to bring it back to where her hands are sitting at, it would keep her once again in a much more relaxed position. So desk sitting syndrome can present as a number of different symptoms that will typically come in the office. Most commonly, we're going to be talking about upper back, so kind of the above the shoulder blades and in between the shoulder blades, as well as neck pain. And so I'm going to demonstrate here an adjustment for both the upper back and the neck, how we check it, how we correct it. And so when we're looking at the spine itself, I'm checking for my subluxation. I'm looking for where there's that loss of motion. And so coming right in through the upper part of the back here, a lot of stiffness right where the shoulders kind of round out. So I'm gonna have you take a big breath. All right, let's flip on over. And then same thing, checking for our loss of motion. If it's a lateral loss of motion, usually looking more towards the lower part of the neck. If it's a rotational loss of motion, typically gonna look kind of towards the top of the neck. With desk sitting syndrome, another thing that we can tend to see is going to be some compression through the upper back and through the cervical spine. Individuals that sit at the desk all day, they're in this kind of a position, tend to get kind of this kind of hunched positioning, kind of like a turtle head effect almost. And what that does is compresses the discs and compresses the joints of the cervical spine, as well as the upper thoracic spine. And so a really good treatment method for this is going to be cervical traction. And so the machine that we have here hooks up under the underside of the skull, what we call the mastoid process. Little pads here, strap holds the head in place, and then as the machine pulls, it'll pull to a position, stretch at that point in time, relax it back down, and then go back and forth between that. Typical treatment for this will last about 10 minutes. Really good stretching effect, and what it does is it helps to elongate the spine, pull the head in an upward position, help to decompress those joints and those discs. With desk sitting syndrome, a very effective method can also be massage. When we're talking about that poor positioning, usually it's gone on for more than just a week, 2 weeks, a month at a time. Typically it's been in the range of 5, 10, 15 plus years at that point in time. What that does over time, as that head deviates its way forward, the shoulders round their way forward, we get a lot of increased tension through the neck, through the traps, and through the upper back. Having massage therapists go in and really work out those knots and those kinks, stretch those muscles out to where they're getting to their normal full potential is going to help to take our body from this real rounded forward position into a much more upright, much more relaxed position and through the neck and then through the shoulders. Hopefully you found this video to be useful and helpful. If you did, like it, share it with your friends.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.